Hi, this is Randy Oostra, and we're here today to talk about the announcement of our partnership with HCR ManorCare. I think many of you have heard about our pending partnership, and I'm really pleased to have Steve Cavanaugh with us today from HCR. Steve has been the president of HCR ManorCare now for almost a year, and has been there a long period of time. So Steve, welcome, and this is a day that we've been very excited about. Maybe you can start talking a little bit about yourself and who you are, and a little bit about your role at HCR.
Sure, great. Well, I'm Steve Cavanaugh. I'm the president and CEO of HCR ManorCare currently. I've been with the company for 25 years. Started working for the company right out of college, right out of the University of Toledo. I actually went to Michigan for my MBA while I was working for the company.
Some people are booing as you're saying that now, right now, as you say that.
I know we got a mixed audience out there, but hopefully the Go Blue crowd will be rooting for me in here. But yeah, and so I've done a number of jobs for the company. I started out in like a strategic planning role for the company. I eventually ran our corporate mergers and acquisitions group. I then was the CFO of the company. I was a chief operating officer of the company, and for the last year I've been the president and CEO. And so we're located here in Toledo, Ohio, and my wife and I live in Holland. We've got two young kids. I've got a daughter, Claire, who's 6, and got a son, Christian, who's 4, and my other hobby is I'm on the University of Toledo Board of Trustees. So Randy, if you could maybe introduce yourself to the HCR ManorCare team, that would be great.
Absolutely. So Randy Oostra, I'm the president and CEO of ProMedica. Been here for 20 years. I've spent my whole career in healthcare. Mostly around the Midwest, Sioux Falls, South Dakota, Minneapolis, Grand Rapids, Michigan, St. Louis, Toledo, and have been here 20 years, raised our children here. I have 3 sons, and they're all married, and they're all 3 physicians. 2 of them actually practice here in Toledo. And you know, this is our home. I have a new granddaughter, so we're excited. We love it here, and it's been a really great addition. And ProMedica, you know, is historically has been a traditional, what we would call an integrated delivery system. So if you were in graduate school in the 70s, they said the thing, if you're in healthcare management, you have to be part of a system, an integrated delivery system. It's all about delivering clinical care. And ProMedica has probably been a great example of that. Regional healthcare system. 17,000 employees, kind of in this Northwest Ohio, Southeast Michigan footprint, doing the kind of services that integrated delivery does. We have 13 hospitals and some affiliates, a lot of ambulatory practice, roughly 920, 930 physicians that work for us. And we have a health plan that has about 600,000 members, a half of which are dental. So if you look at the evolution of delivery systems, that's kind of been our model, based here in Toledo, and kind of servicing the region. We've had some great discussions. I think what's interesting in any communities, you know, we've been across the street from each other now for a while, and really it's just for the last few years that we've really said, you know, we've got 2 great organizations, there's got to be ways to work together. And then I think when you start thinking about the changes in healthcare, I know from our perspective, you know, we're looking to grow. You know, how do you grow in kind of a non-growth footprint where we live today? And you're in markets, some of which are very high growth and opportunities. Talk just a minute about about HCR and the states you're in and the services that you're doing, and just so ProMedica folks understand kind of the breadth and depth of kind of what you're doing and how we work together.
Sure. So to give you a sense, I mean, for those that aren't familiar with our company, I mean, we operate about 500 locations around the country in all of our different lines of business. We're probably doing business in about 35 different states. We operate about 175 skilled nursing facilities, and those are primarily in the Midwest, the Mid-Atlantic area, and then some facilities out west, like states like Washington and California. We have about 60 assisted living facilities, and the vast majority of them are a product we call Arden Courts, and it's a product that's focused on dementia care, Alzheimer's care, and it's really an assisted living type of business, so pre-skilled nursing. And then our home health and hospice business, we have about 120 locations, very similar geographic footprint, so once again, Midwest, Mid-Atlantic, and the West Coast. And so, you know, we're really, I'd say, a semi-national company. You know, we're not in New England, we're not in the Deep South, we're not kind of in God's country in the Rocky Mountains, but pretty much every place else we are. A lot of our markets are big, urban, growing markets, so we have a very, very strong presence in Chicago, Detroit, Philadelphia, Baltimore, Washington, D.C., all the major cities in Florida, you know, the Seattle, Tacoma area, the West Coast in California, Northern California. So we're in a lot of different markets, and I think A lot of them are growth opportunities. And I think going back to your original point about the growth opportunities, one of the things we've struggled with are some of the challenges our company's had. The ability now to be partnered with ProMedica and now start to invest in our growth and our future in all of those markets and all those lines of business. I mean, It's a really exciting opportunity for us.
So, I think sometimes people look at our partnership and they go like, kind of, where in the heck did this come from? But we've been talking about partnering for a long period of time. I mean, we started a partnership actually many years ago at Flower Hospital that we were very, very involved in. As you look at this partnership, what excites you about it? The potential and your thoughts from your perspective, what this means for both organizations?
Yeah, no, I think this partnership for me, it's really exciting, all the possibilities. And you and I have talked a lot about this. When you think about the two organizations and the breadth of services and capabilities we have, I don't think there's any other organization in the country that has what we have. I mean, we have a health plan. You guys have an acute care hospital system. You've got a physician group. You've got an academic affiliation with the University of Toledo. Then you come over to our company and we've got skilled nursing, assisted living, outpatient rehab services, home health and hospice. And so when you start to think about all the possibilities when you put those things together and just doing things like telehealth or figuring out other ways that we can do different kind of payment relationships and have Paramount and our organization partner, there's just endless number of possibilities. And for us, that's really exciting. And then, when we think about things like the fact that you guys are leaders in social determinants of health and how do we put that into our business model and try and improve the care we're providing, that's really exciting to us. And so to me, it's just the possibilities and all the different things we can do and really the opportunity to be pioneers and really create kind of a new way of delivering care. I mean, that's incredibly exciting for us.
Talk a little bit about that. We've had people like, well, aren't they in trouble financially and what's going on with them and what are you people doing? Talk a little bit about just kind of how you see that from your perspective. I don't think people realize how devastating the Affordable Care Act was to at least the nursing home industry. But talk a little bit about that from your perspective and the opportunities, some of the challenges, but also the great opportunities that you have.
Yeah, so I think really, to really put it in perspective, to go back to 2007, and that's when we took the company private. So up until that point, we had been an investment grade public company, and then we actually sold the company to the Carlyle Group, and we did that by doing some financing using our real estate. So after that transaction closed was the beginning of the financial crisis, and so really a lot of the financial markets that were out there that we might have used to refinance the company kind of evaporated. So in 2010, 2011, we had to look to refinance the company, and we actually had to use sale-leaseback financing. So we sold all of our real estate to a real estate investment trust, and that gave us an annual lease that we had to pay. And the lease that we paid was predicated upon the reimbursement environment and the economics that we had at that point in time. And what ended up happening was in our core skilled nursing facility business, we took about a 12.5% reimbursement cut to our Medicare rates, and that's our most important, most profitable payer. As you can imagine, the managed care organizations kind of followed suit and they reduced their payments as well. And there were also a lot of regulatory burdens that were added by the Obama administration. And so that increased our costs by probably somewhere between $50 and $75 million a year. And so you take those three factors and then you couple that with the fact all the changes going on in healthcare where you're getting people well faster and you're trying to get them out of your facilities sooner, it really, really put a lot of pressure on our facilities and our operating performance. And what's interesting is, if you look at our lines of business, all three of our lines of business are profitable. We make money in all of our lines of business. If you look at our margins and our operating performance is as good as anybody in those particular lines of business, the issue is we make a lot less money than we made in 2010 and 2011. And so we found ourselves in a situation where that just basically put so much financial pressure on the company we had to restructure it. And so for us, the opportunity to have ProMedica come in and essentially recapitalize the company, get our financing costs because of your great balance sheet down to a level we can afford, it puts us in a position where our business, we ought to be able to generate enough cash to reinvest in our business and meet all of our reinvestment needs and put some more cash back on ProMedica's balance sheet. And so that's the real opportunity here. And having that new balance sheet and having that recapitalization gives us the position to invest in technology, our employees, growth, new facilities. And so that's really
Right.
exciting. And so that's the real positive of this transaction in our minds.
Yeah.
So.
Well, I know for us, the 12% reduction would be devastating for
Yeah.
ProMedica as well. So, I think that explains a lot. And I think as we just kind of look at the opportunities to work together in a whole variety of areas and the things that we share, very exciting times ahead. Talk a little bit about, your, what you're telling your team going from a for-profit to a nonprofit.
Yeah.
I know we would say that, we're nonprofit, meaning we don't pay taxes, but we still have to run on a profitable basis and do the right things. So what kind of, from your side of the world, what does that conversion mean to you guys?
It's great.
Yeah.
We've actually tried to message it in a very similar way. And what we've said is, we've really had three different sets of shareholders. So at one point in time, we were a public company and we had public shareholders. We then became a private company and we were owned by a private equity firm. We now have shareholders that are essentially, the communities in which we operate. But at the end of the day, it doesn't matter who your shareholders are. You still have to have a business that generates enough profit that you can reinvest back into the business and keep it vibrant and keep it moving forward. So, the mantra we've kind of adopted is sort of, we are going to become a mission-based organization. That's a really cool thing, and we get to serve the communities we're in. But if no margin, no mission. And if we do not have a successful business, we're not going to be able to execute on our mission. And so there's a balance there, and I think that's a real positive. But I've told people, quite frankly, and you and I have talked about this, that, when we started talking about the culture and the values and the way we do business, there was a lot more similarities than there were differences. And really, it was, like you said, a tax status difference more than anything else.
Right.
And so I don't view it as that big a deal, to be honest.
Yeah, we talk all the time, there's this misconception that nonprofits don't make money. And again, as you say, if you're not making money, you're going to go out of business. So we do, we just have the ability to reinvest that money back into our facilities. So instead of money going to shareholders, we have the luxury of investing it back. So you have the local nonprofits, which are very small, typically not a lot of revenue, and I think a lot of the socially based. And then you have healthcare in there, which you have multiple billion-dollar organizations. So the small nonprofits would say we're really not a nonprofit. Nonprofit simply means we don't pay taxes. Right. And so we're able to, we don't have shareholders, we don't distribute our profits to shareholders, we distribute our profits, we reinvest our profits back into our organization or back into our communities. We still have to make a profit. If you don't make a profit, you go out of business. Yeah. We still have to get up every day and manage effectively and efficiently. Yeah. We have the same pressures that you do from reimbursement and expense trends and all of that. We do have the ability, though, to take those, what you would distribute to shareholders, to be able to think about what we want to do with that money. If we want to do a community project, if we want to invest it back in the organization. So I look at it as kind of the best of all worlds. We're mission-based. We get up every day. It's all about health and well-being in people's lives. And we're a large organization. We're much larger with our partnership. Yeah. We still have to run a really solid organization from business aspects. But now we have the ability to take those additional resources and reinvest them either back in our organization, or if we decide to do some things for our communities, we can do that. Talk just a minute about demographics. There's a lot of demographic changes. That's very attractive to us as we think about serving the larger base. Talk to the ProMedica folks a little bit about demographics. They talk about this silver tsunami coming. Talk a little bit about that, and just what's available from just the market that's going to be out there in the future.
Yeah. It's really interesting. So people that don't know a lot about our business say, look, there's all these people turning 65, and that must be great for your business. And I basically look at them and tell them, actually, that doesn't do me any good, because the average resident in our facilities is probably like 79 or 80 years old. So actually, from a demographics perspective, and this is part of what contributed to the financial issues of the company, we've actually gone through the toughest trough in the demographics that we're going to face in our industry, because you think about all the patients today are people that were born right around the Depression era, and that was one of the lowest birth rate periods in the country. But we know exactly what follows that, and it's sort of, as you run into the World War II era and beyond, the baby boomers. And so you see this incredible expansion where the number of people over the age of 65, but more importantly, the number of people that are in that 75 to 85 year demographic is going to double and then triple over the next 20 or 30 years. And so for us, we see that demographic curve probably coming in 2019, 2020, just beginning to start. but we should have 10 to 20 to 30 years of tailwinds as that business just grows and grows and that population grows. So it's very exciting for us, and as I told you, I think it's a great opportunity and timing for ProMedica to be investing in this space, because you're really kind of buying at the bottom of the demographic trough, and you're going to have 20 to 30 years of great run. And so
well, I know from our perspective, that's very exciting. We've always thought about how do you grow in a non-growing area, and when you look at all the demographics, the aging demographics, the increases in home health, hospice, skilled nursing facilities, dementia care, sadly, and then you begin to think about how do you build a larger organization, and healthcare. Hospital-based healthcare traditionally has kind of said, well, we don't want to get involved in that. And really, the more you think about it, it's very intuitive to say, well, given the fact that everybody wants care at a low-cost setting, why wouldn't we embrace it? So I think from our perspective, we're very excited about it. Talk a little bit about change. So this is a change for us. This is a change for your organization. I'm sure everybody's excited for change and they get nervous a little bit. Talk a little bit about that from your company's perspective.
Yeah, so look, I think it kind of cuts two ways in our organization. So first of all, I think people recognize that doing a transaction with ProMedica with the help of Welltower is about as good an opportunity as we could have had to recapitalize the company. And so I think, like you said, initially everybody says, wow, this is great, this is fantastic, I'm really excited about this. And then, like, I think just human nature, everybody then says, okay, what is this going to mean to me? Because they know some things are going to have to change. And I think what we're trying to say in our organization is, regardless of whether we had done a transaction with ProMedica, there is so much going on in healthcare. There were going to be changes in our organization no matter what. Right. And so I think, we've just got to embrace that. And I think the thing I'm trying to tell them is really what you've shared with me, is that we don't view ourselves as being done at $7 billion of revenue combined. Right. We think we're going to double in size, and so that means there's going to be plenty of work and opportunity for everybody. It may be different than what they're doing today, but I think that's what we're trying to focus on. So I'd say people are generally pretty excited about it. They're nervous at some level, but I think for me, what I'm trying to focus them on is this is literally the best opportunity and alternative we could have hoped for. And I think there's going to be so much more opportunity for the two organizations together going forward. It's just going to be incredible.
We were going to change anyway, whether we do anything with HCR, and that's just the way healthcare works. But probably what happened in your organization is what happened in our organization. People are excited and go like, wow, this is great. It's a great partnership. And then a week later, they walk in your office and go, is anything going to change? And you're like, yeah, something's going to change, especially now. And so, I think that's the kind of the nature of what we're about. We're under a lot of tremendous pressure just being in the healthcare space. I think there's change here, but I think more importantly, there's opportunity. And I think, as we've talked about and what we've already talked about today, the idea of putting our organizations together, connecting some dots. Yeah, roles will change, jobs will change. We'll have to transition, people to other roles and responsibilities. But there's great opportunity here, and there's no reason we can't create this great national, international company that's going to provide tremendous opportunities. So we look at this from a growth standpoint, an opportunity standpoint, and I think change is just part of healthcare. It's just part of the way the world works today. And there's no place you're not going to go that you're not going to see significant changes. I don't care what industry you are in. And I think that's just the nature. So, we're all going to change. We're going to change together. And the good news is, from where you were economically, from where we were from a scale standpoint, we've got this great platform to build out for the future. You said Welltower. They're part of this. Maybe you can describe to ProMedica who Welltower is a little bit. I think that's a new name for some of our folks. They may have read it, but they may not understand what they do. Yeah,
so and what's great about this is, so Welltower is a real estate investment trust. They basically invest in real estate. They're a financing partner, and so they are helping us finance this transaction. They're going to own 80% of our real estate, and we're going to own the remaining 20% in a joint venture, and so that's exciting. For me, what I like about Welltower, though, is they're more than a capital partner. They're really a business partner. And so what's been exciting to us is they're not just thinking about this transaction, but they're thinking about other transactions. And there are things we can do together. There are more assets that we can acquire that we could manage with them. And so I think that's really interesting. I think some of the other things they're involved with, they've got a great data analytics group, and they've already been helping us think about our markets and our facilities and where we should be investing and trying to grow and things like that. And so I think they're exciting. And look, the fact that they're based here in Toledo is fantastic. I mean, this is such a great story when you think about 3 great Toledo companies and they come together and they create really a new way of doing business in healthcare. I mean, that's just very exciting.
Yeah, I think
to me.
that'd be surprising for a lot of people to see 3 organizations like this based in Toledo, Ohio, and then the combination, what it can become. You know, we're very excited about Welltower's partnership, as you said. You know, the access they have to markets that we're not in collectively today, which is tremendous. The fact that they're Toledo based, and the fact that we're a partner with them on the real estate. The opportunities that they might bring us as well is very exciting.
One of the things that people want to understand is, what motivated ProMedica to want to get involved and do this transaction with our company. So if you can maybe talk through
Sure.
our employees, how you were thinking about that and what got you interested in that.
Yeah, and there's a couple things. I think some people think this just happened, and we've been talking for years, and started a partnership at Flower Hospital, and then more recently, just because you start to look at the importance of scale, and again, healthcare is just evolving to something so different. And we look at it as kind of a blurring of the lines. So we used to say we were a delivery system. Now we say we're a health and well-being organization, a health and well-being company. And the idea behind that is, yes, we do a lot of clinical things, but we're really focused on the social determinants of health, those social things that really impact a person's health. So 20% of our health is really dictated by clinical care, 80% by other things. And so over the last decade, we put a lot of attention to those social issues in people's lives. Whether you're a newborn, a healthy mom, a healthy baby, whether you're a senior, all those come to play. So, over the last decade, we've really changed our thinking to think not only about those social determinants, what we do clinically. We like the term anchor institution, which means we're mission-based, nonprofit, investing in our communities, because we can do that because we're not publicly traded, and we can invest our resources back in the community. And by extension of that, when you begin to look at all the data, demographics that you know better than anybody, you look at the space, the aging space, and you think about why wouldn't we want to work in that space as well, given all the demographics, and the need to think a little differently from a traditional hospital standpoint, how we look at the space. Why wouldn't we embrace that? Yeah. Low-cost settings, you look at the numbers, and the more we thought about it, it was kind of one of those, common sense things to us. It's like, well, why haven't we gone to this space before? And I think the concern was always the economics. And as we've structured our new partnership, we're very comfortable with the economics. And so we're just extremely excited. We think it makes all the sense in the world. Timing is everything. Partly you'd say we should have done this 10 years ago. We probably couldn't have got it done 10 years ago. But I think everything kind of came to the right point in time. And so we're just extremely excited about what it means for ProMedica, what it means for the region, what it means for our respective organizations, and where we can take this in the future.
Our financial struggles the last couple of years are well known by all of our employees, and we haven't been able to invest in all the opportunities we would have liked to. And I know that's one of the big commitments that you and I have talked about. But I think if you could talk a little bit about some of the plans in your mind about how we ought to reinvest back into the business, whether it's people, other things like that, technology, whatever it is. I think that'd be great for our employees to hear that.
Yeah, I think the first discussions we had, and the more that we understood the economics of HCR and how profitable you were in a lot of different areas, and then really the struggles basically because a lease rate that reimbursement didn't support. And the ability to restructure that, and then the ability to grow that. You look at it from a pure business aspect, and you think, what great potential we have here. Also, we're based here in this part of the United States. We have the ability to create a very large organization. Combined, will be $7.5 billion organization, 30 states, 70,000 employees. We've always had a really solid, balance sheet, AA rated, which puts you in the top 15% of the country. So several $1 billion on our balance sheet. Now, it changes a little bit with post-merger, but we've had resources to reinvest. And so we look at it, as there's no reason we can't, double in size over the next 5 years. We've done that historically. We could create a really great company. This whole space, what we call post-acute, which is a horrible word, horrible phrase. This idea of healthy aging in America, we can redefine that. And the reason I think we can redefine it is I think it's a continuum approach. It's talking about all the things that ProMedica has done, all the things you've done, and really talk about a different approach to aging. And especially with our partnership with Welltower and what they bring, there's no reason we can't create a new dialogue. So we're very excited not only about the current business model, what can be grown, the resources we can invest in, what we might be able to acquire, the idea to work with Welltower in the markets they are in and see what opportunities might be, but also just to rethink this whole concept of aging and actually put ourselves as the national leader in that discussion. So we see this on a very local basis, a regional basis, the 30 states and communities that we're going to be in, and then on a national basis that we have some opportunities there. We also do some work in China, and who knows where this could go. So we're very excited about the potential, and what we're most positive about is the team in place at HCR, our friends at Welltower, the ProMedica team, and I think when you think about it just from a pure breadth and depth, we've got a great, amazing team and a great opportunity ahead of us.
One of the things I've been really excited about is, the ability to, as we've said, kind of have your communities where you operate as your shareholders and think about how you distribute your profits back to them. Can you talk a little bit about, how you view the role of ProMedica as an anchor institution in Northwest Ohio, and some of the things you've been involved with that are maybe outside the traditional realm of healthcare? Because I think that'd be great for our employees to hear. And then also your thoughts about how, as we start to reinvest in some of the communities all across the country that we're involved with, if you've got some ideas or thoughts around how some of that might work, that would be fantastic.
So we think of it in three areas. Of course, the type of care that we provide, the clinical care, the type of care that we provide, and then also the social aspects of people's lives, social determinants of health. And we've been working in that space for the last 10 years. We did it because we thought it was the right thing to do. So we started with hunger, and hunger as a health issue. So last year we screened 500,000 of our patients for food insecurity. Today we're screening our patients for 10 social determinants, and we're beginning to screen our employees for the 10 social determinants. And the idea behind that is we spend $3.2 trillion in this country, 17.8% of our gross domestic product, and yet most of our lives are based outside of healthcare. And so, we have to look more than just at a person clinically. We have to look at those other areas. So we spend a lot of time and effort on these social areas, social determinants, and that has a lot of implications as we think about people aging. So we're excited to talk about that. And the other piece that we look at is what we refer to as anchor institutions. And anchor institutions are simply anchored in place. So they're many times mission-based, nonprofit organizations. They don't have to be, but they're organizations, in our case, that we are mission-based, that we're able to invest those monies back into our community. And the idea there is we're still going to run a solid organization, but why wouldn't we be the kind of organization that would invest some of our money into tackling community problems, so these tenacious problems? So who's going to do that? Is it going to be the government? Is it going to be the social service agencies? Well, ironically, we have more resources many times than they do. So our thought process there is in all three areas. We want to, job one is to take care of people in our care, look at their social conditions in life, and then begin to strategically and as best we can with the resources we have, invest money in those communities. So when you think about it, that's good for everybody. It's good for health and well-being, it's good for individuals, it's good for the people who work for us every day, and it's great for our communities. And if communities do well, they grow, that's better for our business model. So to us, it's just kind of all common sense. So we spent a lot of time and effort looking at these issues. People will hear us talk more about these issues. Don't get me wrong, we have to run the organization crisply and efficiently and effectively. But when we do so, we're able to invest those monies in a lot of those type of programs. So, kind of lastly, just as you think about the opportunity and the partnership, what gets you excited about the future?
I think for us it's the ability to grow and really be a growth engine for the combined organization. And, I think the way I've described it is for the last 2 or 3 years we've had to play a lot of defense and not much offense, and we've missed out on opportunities. And I think now having this partnership, the ability to grow in our traditional lines of business, but also to reimagine, and we literally just had a management meeting yesterday where we focused on all the different possibilities that are available with this partnership, and it is just literally endless. And when you start getting a bunch of people creative and think about different ways of delivering care and better outcomes and lower costs, it's really exciting. And so to be a part of that is just incredible. And like I said, going back to what I said earlier, I can't think of another organization in the country that has everything that we have, and so to have all those different tools and capabilities available to us, that's just incredibly exciting to me.
Yeah, you think about the blurring of the lines in healthcare between what we've done traditionally clinically. We talk about social determinants, we talk about anchor institution investments in communities. And then when you think about the aging piece and how all those lines have blurred, and the opportunity to work together in all those pieces, I mean, it's very unique. It's a very unique opportunity. And I think, as we've talked about it, and revenue is important, but I think it gives an idea of scale. A lot of people feel you have to have a certain size to scale to succeed in the future, and I think there's some truth to that. But to start out as a $7 billion organization in 30 states with kind of a comprehensive look in healthcare like we have, 70,000 employees, the idea that we can partner with Welltower and be based in this region is very, very exciting.
We are so excited about this, and I think really, there is change, and change is inevitable, but I think in this case, the vast majority of it's going to be good, and it's going to be, like you said, more opportunity than threat. And so we're very excited about this partnership, and we can't wait to get started. So we appreciate your confidence in our company and willing to invest.
Great, thanks, Steve. You bet.